If you're looking at the screen, it says UPS concerned about Obamacare costs. Are you concerned with your costs? In March 2010, healthcare reform was signed into law. Healthcare reform contains provisions that have changed and will continue to change the health insurance industry in substantial ways. Here's a company that is seeing the effects and higher costs for its operations. The company, United Parcel Service, plans to drop health insurance benefits for working spouses of non-union employees if they can get coverage elsewhere. With the changes in the new healthcare law, it sees no other choice and blames it for their decisions. The company currently has over 15,000 employees and has nearly 33,000 spouses it covers currently. However, will drop those spouses effective January 1st, 2014 for spouses of United States employees. UPS cited a benefit consultant survey that found more companies are planning on restricting benefits for working spouses. UPS said that it was making the changes because of rising healthcare costs and the 2010 law championed by President Barack Obama. The company said that it considered letting employees pay extra to cover their working spouses, but decided that that would be too difficult to do. Since the Affordable Care Act requires employers to provide affordable coverage, we believe your spouse should be covered by their own employer, just as UPS has a responsibility to offer coverage to you, the company said in a recent memo sent to its employees. According to a benefits consultant, Mercer, relatively few large companies excluded coverage for spouses who have the option of other employer coverage. Mercer said that in 2012, just 6% of companies with 500 or more employees excluded such spouses, although that was double the percentage in 2008. It said another 6% levied a surcharge to cover those spouses. Employers are thinking about it because health insurance costs are continuing to go up, said Mercer's partner, Joan Smythe. They're trying to walk a fine line between being fair to their employees, but also being fiscally responsible. Smythe said employers are waiting to see whether spouses can find coverage from public insurance exchanges to be created under the health law. Other provisions of the law, such as per participant fee to subsidize premiums for high-cost people in the individual policy market, and encourage employers to reduce the number of people they cover, she said. Paul Fronston, a senior research associate at the Employer Benefit Research Institute, said the percentage of employers booting working spouses off plans is still small. It's more common to simply add a surcharge for insuring them. However, trends start with small numbers, he said. There's a herd mentality. When you have a big employer like UPS do this, it's easier for other employers to do the same thing. In explaining the change to employees, UPS cited a survey by consultant Towers Watson. That firm surveyed 583 employers and reported growing interest in reducing coverage for working spouses. It said 4% already exclude spouses who can get coverage through their own employer, and another 8% plan that in 2014. Many more, 20% now, and rising to 33% next year, impose a surcharge for covering that same working spouse. Andy McGowan, a UPS spokesman, said the change was part of the company's effort to keep health insurance premiums at or below current levels for a significant number of employees. He said the company's premiums have risen sharply in recent years. UPS told employees that spouses will no longer be eligible for physical and mental health benefits and prescription drug coverage. However, you may enroll her or him in dental, vision, and supplemental benefits such as life insurance, even if the spouse's employer provides those. UPS told workers it added that spouses eligible for Medicare won't be excluded from the coverage. The change also won't affect UPS union workers, many of them represented by the Teamsters. Their health benefits are spelled out in labor contracts. The new policy will produce one benefit for the non-union employees. Those whose spouses lose UPS coverage will see their share of their insurance decline. The company said it could be almost $1,600 for some of the workers. This UPS change was first reported by Kaiser Health News and USA Today. Now, we cannot predict the outcome of any future legislation or litigation related to the Health Care Reform Act, as described under Item 1, Business, Health Insurance Industry, and Market Opportunity. We actually expect that health care reform to result in profound changes to the individual health insurance market and our business. So, my advice would be prepare yourself. Get a free quote on your health insurance at www.aiadirectquote.com, or if you're watching this on YouTube, just merely click the link in the description underneath this video.